I'm here with Professor Donal Buggy from the Mater University in Dublin. Thank you, Professor Buggy, for your fantastic chat on oncoanesthesia. So if I was having a patient tomorrow and she had breast cancer, what would you recommend I do for my anaesthetic?
Basically, Alan, exactly what you did yesterday or what you did last month, because for all this scientific work that's going on and valid experimental work that's going on, and indeed retrospective clinical work and translational studies that are going on, to date, at this point, we do not have enough solid data in the form of prospective randomized trials for anyone to change their practice to any particular anesthetic technique. So although there are signals suggesting that certain techniques or drugs have certain behaviors in relation to cancer cell biology, none of them amount to a practice-changing set of evidence to date. And what we need, of course, are the randomized controlled trials. I hope to have one to be jointly leading one with Outcomes Research Consortium that we hope will report before the end of the year, and that won't be the end. That'll be the beginning, I believe, of a journey to evaluate randomized controlled trials. And indeed, on the registries there are as many as 9 randomized controlled trials in various tumour types that are ongoing at present, and we hope that gradually they will be the tools which will shed practice-changing light on this question.
Fantastic. And I'd like to also ask you, you run, I think, the world's first oncoanesthetic fellowship program. Can I ask you a little bit about that?
Well, thank you for the flattery, but that's actually not true. I'm sure my oncoanesthesia fellowship is far from the first, but certainly the global movement of paying more attention to oncoanesthesia as an emerging subspecialty within our specialty has led to spawned a number of fellowships, and I suppose the only claim to fame I would make is to have the first Irish one. Indeed, Dr. Ashton Sherwin, who is here and who was participating in the Emerging Leaders Congress, which preceded this Congress, is our inaugural oncoanesthesia fellow in Ireland. So essentially what that is at present is a largely clinical workload, whereby her workload is with oncoanesthesia, with cancer lists, with cancer patients every day of the week, and it provides a very fine culmination of training, because of course the workload shifts from, we say, gastroenterological cancer lists today to thoracotomy lists tomorrow, to breast, to every form of cancer in any large tertiary referral cancer centre would provide this training. But in addition, it's more than just training our very bright young people to be good at looking after sick cancer patients. It's very much about helping these young fellows to, in the future, be leaders in improving perioperative care of the cancer patient. So in helping to engage with other specialisms to optimise perioperative care of the cancer patient by means of developing systems and structures around, for example, specialised preoperative assessment for high-risk cancer patients, optimising ITU for cancer patients where appropriate post-operatively, and also perhaps getting involved in the development of clinical care pathways for cancer patients. In other words, we would hope that the oncoanesthesia fellows worldwide, in my centre and others, would be agents of improvement, quality improvement for cancer patients wherever they will work as leaders and consultants themselves.
Fantastic. Thank you very much for your time, Professor Buggy.
Thanks, Alan.